We are confident that there is the willingness to recognize first the value of vaccine, to make it a priority, and two, that we will find a system where, yes, Gavi country will receive the lowest price, but middle-income country will receive an intermediate price. And probably there will be 3 or 4 classes, but we should agree principle. And I know that we are collaborating, for example, in Brazil. I know that this concept is accepted. But it's a concept, I think, which is key if we want to achieve sustainability of the vaccine industry and innovation. And personally, I believe that we should not call the R&D-based industry or the developed industry or developing country industry. We are one vaccine industry.
In going around one last time, please take us down to the level of action. What one action do you think is important in reaching the 5th child? What do you think this global group will look like of vaccine manufacturers at the end of the decade of vaccines collaboration? What lessons have we learned, to take a page from David Gould's book, from the last 10 years that'll make us do things in the next 10 years differently? So 10 years from now, at the end of the decade of vaccines, what is this going to look like in terms of a global industry? Will we have reached that 5th child? And what do you need someone to do now, thinking differently, learning lessons to ensure that we get there?
I think, Peter, that there's tremendous opportunity for collaboration between the so-called developed world manufacturers and the developing world manufacturers. And there are many examples of where this has happened. And the types of collaboration can be anything from a full technology transfer, or it can be a partial tech transfer. So drug products manufacture, formulation, filling, and packaging. And for this sort of technology, I think partial tech transfers are more likely to be the solution.
We had a very good experience, cooperation and collaboration with a big company like Merck. And a very good example is hepatitis B, recombinant hepatitis B vaccines. They technology transferred to the CMVG in, let's say, 20 years ago about. And we manufactured by ourselves and provided the vaccines to the whole country wide. And the data we got last year, and the hepatitis B incidence decreased almost 10 times in the child less than 5 years old. This is a very significant contributions of the vaccines.
I think from my perspective, my members, almost 11 or 12, are here attending for the first time this conference. And our commitment to the global health is that today the UN agencies are procuring almost 80% of their needs from the developing country vaccine manufacturers. But for the additional new products where we need to do and make collaborations, it is important that we collaborate even with our colleagues from the IFPMA. And without that, this access to the people at the shortest possible time will not happen. However, one thing everybody must remember, that there is a minimum cost for empty vial. There is a vial, there is a rubber bunk, there is aluminum seal, packing material, cold chain, everything, and that cost is going to be there. Everybody wants cost to go down, but beyond certain limit, cost will not go down. Whether you manufacture it in the north or in south, it's going to remain the same. So that is something, if we have to achieve that, vaccine should be available to the people in the remotest area at the most affordable price. I think the joint collaboration needs to be existing.
The worry that I have in this context is that whether we're talking about product innovation or we're talking about partner innovation, the regulatory environment needs to also be innovative to support that. And we can't have product innovation without regulatory science and sense. We can't have partnership innovation without a legal regulatory climate that allows us to even have conversations in the same room with each other, which right now we can't actually do without lawyers being present. So it's very important to recognize that innovation isn't just about the antigen or the adjuvant. It's about how we can interact with each other and how we relate to each other across the whole spectrum of that vaccine opportunity that's in front of us.